From very early in the pandemic, it was clear that COVID-19 can damage the heart and blood vessels. But now, the first large study to assess cardiovascular outcomes 1 year after a COVID-19 infection has demonstrated that the virus's impact is often lasting. Fox Chattanooga's Brianna Idzior breaks down the new study and ways to keep your heart healthy.
February is American Heart Month, and a new study suggests that COVID-19 could have long-lasting effects on the heart. I spoke with two health experts about what they've discovered during the last 2 years of the pandemic.
COVID is known to cause cardiovascular problems, especially on those who have pre-existing cardiac conditions.
A study published in Nature Medicine looked at more than 11 million U.S. veterans and found that the risk of 20 different heart and vessel diseases was substantially increased in those who had COVID 1 year prior compared to those who didn't.
Those who have risk factors such as high blood pressure, diabetes, high cholesterol, those folks are at increased risk of having complications related to COVID-19.
And Dr. Farah says it isn't just older folks who are seeing the long-term effects.
I've had some young patients who've contracted COVID-19 at the very beginning of the pandemic, which is now a little over 2 years, and they're still struggling with their symptoms and not able to fully come back to their baseline.
Taryn Anderson with the American Heart Association in Chattanooga says the lack of research was initially concerning for heart patients.
There wasn't a lot of research to tell us what to look for. And so very early on, we fast-tracked over $2.5 million worth of research to determine how does COVID interact with heart survivors.
She says a lot of the evidence of long-term COVID effects is still unknown or just coming out, but she encourages anyone at high risk to check with their doctor about how to stay healthy.
Have a conversation with your local physician about what's right for you and what steps you need to take to make sure that you stay healthy.
Reporting in Chattanooga, I'm Brianna Idzior.
More than 77 million Americans have had and recovered from COVID-19, and those are just the cases recorded by the government.